with that, and moving into the next panel, we're really happy to welcome Paul Sonnier, one of the key digital health leaders globally, who is also runs the digital health LinkedIn group, which I think is close to 100,000 members now, the largest group of any health IT or digital health LinkedIn group out there. And he will be interviewing Doron Dinstein from Entree Capital, founder and partner there at Entree Capital. Doron is from Israel, and we'll be talking about some of what he picked up last week as well, and some of what he's doing in venture in the Middle East and Northern Africa. Welcome to you both, and really good to see you today. And Paul, handing the virtual microphone over to you.
Thanks, Stan. Really appreciate that introduction. Another great event, of course, and as Stan mentioned, I'm known for founding the digital health group on LinkedIn a little over 10 years ago and promulgating the term digital health and my definition for it around the globe. And so it's great to be here and talking with Doron Dinstein, who, as Stan mentioned, is an MD, MBA, and a venture partner from Entree Capital, which is a UK and Israel-based venture capital firm that manages over 650 million in assets across various funds, and actually just closed a new $300 million fund, or several funds. So Doron, great to talk to you again. Thanks for joining us. And with that, maybe you can tell us a little bit about yourself and your role at Entree.
Sure, thanks a lot, Paul and Stan, for having me. So I'm a physician by training, as you mentioned, and I've been for the past 2 decades in the medical device industry mostly, and transitioned into venture capital just over the last couple of years. I've been privileged to join Entree Capital to lead the healthcare investments. So yeah, we just announced this week the raising of the early stage and the early growth funds, number 4 and number 2 respectively in our series. Puts our fund at assets under management just about $1 billion. We've got over 120 portfolio companies, of which about 10%, I would say, are healthcare related. And we invested in pretty much everything: pharma devices, digital health, digital therapeutics. And at a certain point, it becomes a judgment call on where do you draw the line on something being healthcare or consumer tech. And we just see a lot of blending with technology, especially on the digital side of things, where it becomes a question mark on how do you define health, or especially digital health, for our conversation here today.
Yeah, and that's a great point. As you and I talked about previously, and every time I have a conversation about this, the lines are blurring, and where do you separate or demarcate healthcare, and when consumers are managing their own health, and then that data or information crosses over into the healthcare system. So that's why I do have such a broad sort of overview of what digital health is. And then, of course, you parse it down as appropriate and as needed. So thanks for kind of highlighting that. You're preaching to the choir on that one. So, with that point made, how has investment in digital health changed, over the last 5 years? I know there's a lot of talk, and I've seen this in subsequent years or previous years, that there's this bubble, and people say, oh, it's not sustainable. And when we look at how big the healthcare market is, the amount of investment kind of pales in comparison. So, I know you have some great thoughts on that, and I'd like to hear you expand upon those.
Sure, thanks. And it's really a big topic to try and try to cover in just a few minutes. There's been a huge change. Now, obviously, we're going to look at the BC, before COVID era, and post. So people are talking about the fact that healthcare, at least in the US, was about 17.7% of GDP in 2019, and it was talked about being unsustainable. Yeah. Well, COVID came in, and then 2020 it was 19.7, so it was bumped up 2 points. And the question is it sustainable or not? And I'm not the person to say, but my belief is that we're going to see healthcare being a bigger part of GDP in other countries as well, because therapies are becoming more expensive worldwide. Now, it's going to keep going up until a certain point, and it's going to equilibrate over time. But what we're seeing right now is that a lot of these new technologies coming out are making things more expensive. We're seeing care gaps. in the US as well as other places around the world, and we're expecting technology to fill in those gaps in most places. And those are trends that we're going to start seeing. It's not just healthcare that's changing, right? So we've seen a lot of different things. You mentioned how our investment is going to be different. Macroeconomic changes have impacted everything. So if a couple of years ago we would make a seed round, today's seed round looks like what used to be a B round just a couple of years ago. Now, if I'm cutting a check into a company and getting a certain amount of equity, if I'm paying more for less equity, that's going to impact my returns to the LPs further down the line. So what we've seen in 2021 is just not going to be, it's not sustainable overall. I mean, the math just doesn't work out.
Yeah, so on that last point, so what makes an innovation worth investing in then if you're worried about the returns down the road? You mentioned, the prices of healthcare are per capita, per GDP going up based on technology, which is kind of the opposite of what we're led to believe is the case. So does it have to do with you're looking at perhaps the scalability of a solution in the market? What are your thoughts on that?
Yeah, well, a lot of it has to do with the product market fit, right? It's got to have a great team that has deciphered or discovered or found something that is currently underserved and that they have a unique value proposition that will allow adoption. Now, it's not just a product. A product on its own and in today's world is not going to cut it because you need to be interoperable. You need to be something that can integrate into EHRs. You need to be something that's going to work with other things too. And this is something that you and I discussed in the past on the issue of, is a provider going to walk around with 100 apps on their phone to manage a single patient case? It just doesn't make sense, right? Yeah. So even if the technology is great at its base, how is it going to work out for the provider or for the patient or for the system? It's got to be part of a bigger picture, I think.
Yeah, and to reuse the cliche, what's the killer app in healthcare or digital health? Is it what you're alluding to? Is this interoperability, say a platform? And I know there's a number of players out there like Found a Health, Redox, I think was it Gorilla Health? I forget the name, and maybe Validic, I think, come to mind.
And all of them, and there's a bunch of players that are allowing some integration of data, and I think it's still somewhat of a white space. I can't say that people figured it out. It's not just being on OrChart for Epic, right? I mean, it's got to be something that is more universal. Now, the question is a middleware the right solution? Is the market's big enough to have Pepsi and Coke, right? I mean, you can have more than one. So there are a lot of questions here on how it's going to work out. I can't say I have a certain, specific solution or a crystal ball that I know how it's going to play out. But I think that it does leave a certain amount of an adoption to barrier. Even on not just in the provider side or the physicians. Think about the CIOs of hospitals. And what's the network is already kind of heavy, and we're using a certain level of infrastructure. We're going to load it with even more and more users with heavier data. Think about how much data is in DNA.
Yeah, and just as you were talking, I remembered that we saw the new announcement from Kaiser Permanente Graphite Health, so healthcare systems working on this challenge, if you will, interoperability. And even Google, the news from Google working with the VA healthcare system. Mm-hmm. So yeah, I guess, with all that in mind, what is Entree Capital looking at in 2022? What are your big sort of focus areas and what are you excited about?
So a lot of the fundamentals of investing haven't changed because of COVID or the valuations, right? So we're still looking for great teams. We tend to be early stage investors. One of the things that we see a lot of is the consumerization of medicine. and the digital health space that's growing and allowing for it. I mean, when we were kids, you didn't expect comfort or convenience from the healthcare system. Today, we expect it to be on our cell phones and available 24/7. So I think perceptions have changed. This is a sign of the times and other technologies unrelated to healthcare, but it's the same trends that are leading to it. I think that the digital first that we're seeing is not a fad, it's here to stay. It makes a lot of sense that before driving to an emergency care facility, you're going to be able to sit at home and be directed or triaged for the right type of care. I think that we're going to see a lot of devices complementing a lot of these digital technologies because we need to analyze certain parameters at home. So we invested in types of completely new type of imaging. So it's a device, it's not digital, right? But it complements the exact same trends that we're talking about here. A device that will optically do blood tests without even a droplet of blood being shed. Such technologies that are pushing healthcare into the consumer home now, that's the grand vision. That's probably a decade or two away. Some of these things are going to make it into the point of care type of facilities. You know, we can talk about the minute clinics that we're seeing, you know, in various places. It can be into the outpatient setting, but a lot of these things are going to help us shorten the cycle of care, so you're not waiting on lab results. So a lot of great technologies and opportunities in those spaces, as well as things that enable things to work. You know, the middleware we were talking about earlier, it's not for the patients. Not directly, but indirectly will help a lot.
Yeah, I think your point about the consumerization of healthcare is really intriguing, because when we look at disruption in industries historically, like my favorite example I focus on my keynote is Google disrupting the newspaper industry, and not by creating news content, but by basically taking away the revenue, the advertising dollars. And so when I look at healthcare, when I think about consumerization, consumer health, digital health, broadly speaking, you know, I think it behooves investors and healthcare systems and all stakeholders to look at this potentiality, let's say, you know, and kind of have that as a risk management on their mind. So, well, thank you, Doron. I really appreciate your time and your insights. It's really exciting what you're doing at Entree Capital. So I appreciate it very much.
Thanks a lot. Thank you so much for having me, and it was great seeing you again today.
Perfect. And again, thank you, Paul, for not just today, but for running this monthly part and session of the symposium each month. Thank you both.
My pleasure. Thanks, Dan.
Thanks a lot.